All right, good afternoon, everyone, or good morning if it is still morning where you are. Thank you so much for joining me for Caring for the Mind, providing mental health information at your library. My name is Jared Irwin. I'm the Consumer Health Coordinator for the network of the National Library of Medicine, Southeastern Atlantic region. And I'm so happy you've decided to join us for this webinar. Mental health and well-being is a very important topic, and it's something that I'm passionate about. And I hope that over the next hour, you'll be able to your own institution and communities. So before we get started, there are just a couple of housekeeping details I want to cover. This session is being recorded. After the webinar, we will post the recording on Nnlm's YouTube channel. And when that happens, you will be emailed a link to the webinar recording along with a link to the course page that has the slideshow as well as some other resources on it. And that will happen about 2 weeks from today. This session is eligible for 1 hour of continuing education credit from the Medical Library Association. And that hour also applies to the Consumer Health Information Specialization, or the CHIS. So we will have information about how to claim that credit at the very end of the session. If you would like to have live captioning for this session, we will have a link for that in the chat box. And excellent. My colleague Liz Waltman is kindly joining us, and she will be monitoring the chat and dropping in links from time to time as it's appropriate. If you have any questions or comments, feel free to enter them in the chat box. Just make sure that you select all participants from the drop-down menu here. That ensures that I and everybody else can see what it is you are saying. All right, so with that, let's get started. So just to give some context about some of the different names and acronyms you might have heard around or hear in the context of this presentation, I want to talk just a little bit about what Nnlm is and where we fit within all these different organizations. You're probably familiar with the National Institutes of Health, which is the United States' national research agency. There are many different institutes and offices that are part of the NIH, and one of those is the National Library of Medicine. The Nnlm is the world's largest biomedical library, and it not only maintains a large collection of print materials, but it also develops some online resources that you may find very helpful, and we will look at some of them in this presentation. The Nnlm has an outreach and education program called the Network of the National Library of Medicine. This is a program that does continuing education webinars, just like this one, and it also supports health outreach projects through grant funding and providing other resources and support. And the Nnlm is divided up into 8 regions. I'm from the Southeastern Atlantic region, which serves 10 states, as well as Washington, D.C., Puerto Rico, and the U.S. Virgin Islands. I am located at the University of Maryland in the city of Baltimore. So the mission of Nnlm is to advance the progress of medicine and improve public health. And we want to do that by providing all health professionals in the U.S. with equal access to biomedical information, as well as improving the public's access to information that will help them make informed decisions about their own health. So here's our agenda for today. We will start by taking a look at some background information about mental health and wellness. We'll talk about some best practices for reference conversations when you're talking about mental health or having a conversation with somebody who might have a mental health condition. We'll look at some health information resources, as well as some additional resources and collections you may find useful. And then we'll conclude by looking at some next steps and ideas for ways that you can engage your community in learning about mental health and wellness. Now, I want to stress that this course is not a mental health first aid course. We won't be talking about topics like how to respond to mental health emergencies, such as a patron who is having suicidal thoughts. It's also not a safety and security training. These trainings can be very valuable, and at the end, we will look at a few options if you want to pursue these types of trainings. All right, so to start off, we will talk about some mental health information on a broad scale, some statistics and some key definitions and terms that will help us as we're talking about this topic. But first, I want to hear from you. When you think about mental health in libraries, what comes to mind? What are some concerns that you have observed in your community or that your community members have asked you about? Take a moment, if you would, to let me know in the chat box. Right, I'm seeing isolation, I'm seeing depression, I'm seeing domestic issues, talking about problems at home, Alzheimer's care, COVID anxiety, definitely very relevant. Yeah, concerns about stress, concerns about grieving, absolutely. Anxiety, depression. Yeah, these are all very common and very important mental health issues to be thinking about as we're talking about this. And of course, there are many others in addition to that that we will look at as well. Right. So here are a few of the common topics, and I think we've hit on many of them just in your contributions, and thank you for that. So I just want to emphasize that the vast majority of interactions that you have with patrons who might be struggling with any of these issues, they won't be emergency situations. Like, they won't be situations where they or you or any of your institution staff are in danger. So if it helps to take some of the anxiety that might be surrounding this topic or discussing this topic away, then you can take some reassurance from that. Mental health issues and related issues are very common. They're the stuff of everyday life, and it's something that we are capable of doing something about with our communities. All right, so mental health conditions are, in fact, very common. Depression is the leading cause of disability worldwide, and it's a major contributor to the global burden of disease. About 1 in 5 adults will experience mental illness at some point during their lifetimes. But there's some recent research that suggests the COVID-19 pandemic is exacerbating this, and that the rate at this point might be even higher than that. In addition to that, 1 out of 25 US adults, or about 4%, will experience a serious mental illness that has a major effect on their ability to function and complete just activities in everyday life. And it's not just adults either. About 17% of youth who are aged 6 to 17 will also experience a mental health disorder as they are growing up. So it's a very common and very important topic to be talking about. And as is the case with many health issues, there are disparities related to mental health as well. And in particular, the US Surgeon General has stated that members of ethnic and racial minority groups in the United States face a social and economic environment of inequality that includes greater exposure to racism, discrimination, violence, and poverty, all of which take a toll on mental health. So if we're thinking about social and environmental influences on health, well, those also extend to mental health too. All right, next let's talk about a few key definitions here. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act as we cope with the difficulties of everyday life. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood and old age. Now, mental health disorders, or mental illness, are serious conditions which can affect your thinking, mood, and behavior. They may be acute or chronic, and they can affect your ability to relate to others and function in everyday life. Some common mental health disorders or illnesses include anxiety, depression, eating disorders like anorexia, personality disorders, post-traumatic stress disorder, and psychotic disorders. All right, now, what kinds of things might prevent someone from getting mental health services if they might want it, even if they think they might have some kind of mental health issue? What sorts of things might potentially be barriers to that? So even if they know that they might have some of these contributing factors here, they might be reluctant or unable to seek treatment. So what sorts of things might contribute to that? I'm seeing stigma, I'm seeing cost, access to providers in the community, lack of insurance, yep, availability, accessibility, embarrassment, fear. A belief that they don't need help or have a problem. Yeah, being able to recognize the need for it is, of course, an important part of being able to seek treatment. A lack of a support network. Yeah, shortage of healthcare providers. Yeah, those are all terrific examples of potential barriers to mental health, seeking mental health care in particular. So even if somebody does recognize that they might be vulnerable or might benefit from seeking help, there are potential obstacles that can discourage them from doing so. And we've covered a lot of the most common ones here, including things like not having health insurance, not having transportation. Language barriers can also be a significant issue for certain communities. So yeah, there are all kinds of things that might make it difficult for people to have access to the care that they need and deserve. And in particular, I want to take a minute to talk about stigma as a major challenge for accessing mental health care. Stigma can lead to prejudice and discrimination, and it can prevent people with mental illness from seeking out help they need, even if they recognize they might need it. When we hear stories in the news or the media that stereotype people with mental illness as dangerous, that's an example of stigma. Stigma can manifest itself in a lot of different ways, including avoiding work or other people if you have a mental illness and you're afraid of being judged for it. And stigma also makes it difficult to even talk about mental illness. Talking about mental illness isn't as easy as talking about diabetes or heart disease for many people. So another question that you can answer in the chat if you would. What percentage of people do you think with mental illness have experienced stigma? Is it 25%, 50%, or 75%? All right, I'm seeing a lot of 75%, and that is indeed the right answer. As we've said, stigma can often bring on experiences and feelings of shame, blame, hopelessness, or distress. It can result in misrepresentation of people who have mental illnesses in the media, and it can also lead to reluctance to seek or even accept help if it is offered. All right, one more question related to stigma. About what percentage of violent acts can be attributed to people with severe mental illness? What do you think? Is it 3 to 5%, 15 to 20%, or 40 to 50%? All right, so I'm seeing a little bit more of a mix this time in the responses that we're getting. The correct answer was 3 to 5%. And in fact, people with severe mental illness are over 10 times more likely to be victims of violent crime than the general population. Now, mental illness alone doesn't increase the risk of violence, just by itself. But mental illness combined with certain other risk factors, such as substance use, can potentially increase the risk of violence. Previous research has identified other factors that can predict violent behavior, including a history of physical abuse, having seen parental fighting, being victimized themselves in different ways. And it's important to recognize that mental illness can happen to anyone, regardless of some of these things that might be correlated with it. Mental illness has no racial, economic, or intellectual boundaries. So next, let's talk about health literacy and mental health literacy in particular. Health literacy is the degree to which individuals obtain, process, understand, and act on health information. So it's a set of active skills, not just knowledge that somebody acquires, although that's important too. It's a set of practices that somebody is able to put into action. So mental health literacy surrounds knowledge, beliefs, and abilities that lead to the recognition and management of potential mental health problems. And that's essential to early recognition and intervention in mental illnesses, as well as reducing stigma. In general, the earlier that mental illness is identified and treated, the better the prognosis or the prediction of the course of the disease will be. And one of the great things about libraries, and public libraries in particular, is that the doors are open to all people, including those who might have the greatest need for information about mental health. So we are in a great position in our work to meet a very important need in our community. All right, so in the next section, we're going to talk about some best practices for reference interviews. Before that, though, I want to pause and check to see if there were any questions in the chat. Liz, did you see any questions come into the chat?
I did not, and just a reminder to everybody, I am hanging out in the chat, so if you have a question at any time, just drop it in and we will relay it to Jared at opportunities like these.
Okay, great. Thank you so much, Liz. With that, let's dive into some best practices for reference interviews. Okay, so what steps would you take when you are assisting someone who is searching for sensitive mental health information, information about mental health issues, whether or not they necessarily might even have a mental health condition? What sorts of steps would you take if you're assisting someone in seeking out this information? Okay, I'm seeing speaking with them in private. Yeah, that can be a valuable way to go. Yeah, asking about what they have already seen or what they already know about the condition is great. Identifying which age group the information is for. That's terrific. There are some great resources on mental health that are specifically geared toward younger readers, so that can be a great thing to explore as well. Introducing good publicly available resources like Medlineplus and mentalhealth.gov. That's great. Yeah. Asking if they're looking for local assistance resources or if they're just looking for general information. Yeah, figuring out what type of information it is that they're looking for is important as well. Yeah, those are all terrific suggestions about how to get started with having these potentially sensitive conversations. So thank you for contributing those. One good strategy that can also be used is the use of open-ended questions. And this is a great way to go about it because it encourages people to talk more about potentially sensitive topics rather than a yes or no question, which might make it a little easier for the conversation to just stop. So there are some examples of that on the screen here. They include what kind of information on this topic are you looking for? Would you tell me more about this topic? And open-ended questions can also include clarifying what it is the person means. So when you say this, what exactly do you mean? And as somebody had mentioned in the chat before, you can establish what the person already knows about the subject at hand and go from there. So what do you already know about this topic? There are some more examples of this in a handout that's on the course page, and Liz has put the link to the course page in the chat box, so you can check that out at your convenience. Another good strategy is to use person-first language when you're talking about people who have mental illnesses. So instead of expressions like a schizophrenic or an alcoholic, you could use language like a person with schizophrenia or an individual with alcohol dependence. And this can be important because of the stigma that's often connected with mental illnesses. When we use this person-first language, we emphasize somebody's humanity and their dignity as a person apart from any condition that they might have. And that can be a good way to affirm somebody who's seeking information about something that they may feel stigma about. Now, be aware that in some communities, this is not the preferred way that they ask to be referred to. For example, members of the autistic community or the deaf community sometimes view their condition as a source of pride and as part of their identity. So person-first language like this is a guideline. It's not a rule that applies to every audience in every case. When interacting with patrons, always refer to people in the language that they prefer or that they use themselves. So empathetic listening is very important when you're talking about mental health issues. And here are some key elements about empathic listening. When someone approaches you to ask a health question, be sure to listen to what they are saying and to remain non-judgmental. It's important that you are not distracted or attempting to help several people at the same time, if possible, to ensure the privacy of the individual and also to make sure the individual feels that they are being heard and understood. Health questions can sometimes be sensitive, and you want to be able to validate the person's concerns and fears about whatever it is they may be asking about. Another thing to keep in mind is that sometimes people will become emotional when they are asking health questions. They or a loved one might have just received a diagnosis with a serious health condition. So there are all types of possibilities, but it is good for you to remain calm and allow the person to work through their question as best they can. Another thing to remember is to be prepared for pauses and silences. I'm sure many of us have had experiences where we assist somebody with a health question, and then all of a sudden, there's just silence. Try not to think of that silence as awkward, and don't feel the need to fill the silence right away. Sometimes that's just the time that someone is taking to gather their thoughts, or they could be processing the information that you've given them, or determining how they want to phrase the next question to ask. Finally, it is very important to know the difference between providing health information and giving health advice, and to direct people to qualified healthcare professionals as appropriate to answer questions that are outside of our scope. As librarians, we cannot give medical advice, so it's in our best interest and our community's best interest to refer individuals back to their healthcare providers if they have questions that are beyond what we can answer. All right, now conversations about mental health can understandably get quite emotional sometimes. Now, Michelle Spatz outlines a 4-step approach to regaining self-control in situations like this. She wrote about these in her book, Answering Consumer Health Questions. Step 1 is to stop. Try to calm the thoughts that are going on in your mind. Tell yourself to stop any anxious thoughts or negative self-talk about your ability to handle the situation. Step 2 is to breathe. Take a deep breath and release tension and calm yourself. Step 3 is to reflect. So ask yourself, what's really going on here? What personal buttons of mine are being pushed right now? Do I need to distance myself emotionally from this situation? And finally, step 4, choose. Choose to respond rather than simply reacting. Once you are calm and you have more clarity about the situation, you can communicate that you're willing to find common ground with the person and resolve the situation. You could say something like, what do you need right now? Or, you're right, how can we work this out? All right, so now we'll talk a little bit about communicating with people who might have a mental illness and might be displaying certain behaviors as a result. It's important to stress that most people with mental illness, including common ones like anxiety or depression, won't be causing disruptions in your library or your institution. But in some cases, someone with a mental illness might behave in a way that prevents your institution from being a safe space for others. But again, that is the exception rather than the norm. So some important things to remember in situations like that are to be respectful of the person and not to assume a lack of intelligence. Mental illness doesn't mean that somebody is stupid. It doesn't mean that they don't understand what's happening. So you can start with the assumption that the person is competent and able to understand and that you're able to communicate with them. At that point, it's important to be honest with the person about the behavior that might be disturbing other patrons at your institution. So you can accurately describe the specific behavior that is causing a problem. And it's important to do that rather than ignoring it. You don't want to ignore the problem. You want to set clear boundaries and limits and even expressing consequences and explaining what can happen if the person isn't able to change their behavior. So you can start out by saying something like, is everything okay today? So you can start from a position of offering help to the person. And after that, you can be very clear about why you are speaking to the person. You could say, your behavior is making other people upset. Is there anything I can do to help you today? And if necessary, you can say, if I have to speak to you again, I will ask you to leave. And I encourage you in situations like that to take a coworker with you for your own safety, and so that if there are questions about what exactly happened, that there are multiple people who can establish that. And it is always an option to contact security at your institution if it is necessary. You are not a bad person for making your place of work feel like a safe place for others. All right, so having gone through all of that, I'd like to hear from you. What are some common mental health questions that you've been asked at your work? Are there common illnesses or common needs or just other mental health related topics that people have asked about? Seeing post-traumatic stress disorder, bipolar disorder, postpartum depression, anxiety, including anxiety about going back to school, finding local mental health care providers. Yep, that's important. Social anxiety. And autism. Child mental health and parent divorce. Yeah, family dynamics are an important mental health related topic, to be sure. Help with learning disabilities. Understanding why a family member chose suicide. Yeah, those are all really important topics, and yeah, we can, as librarians and information professionals, we can help connect our communities with information to address some of those questions and some of those topics. So here are some common mental health questions that I've come across in my own experience, and also from talking with other librarians, just like yourselves. We've covered many of the common ones, including PTSD, family support, depression, bipolar disorder. And yeah, as you can see, there are a wide range of things that can be covered under the umbrella of mental health. It's a broad category, and there are many different things that are encompassed within it. But even though it can be a complex topic, I'm confident that we as information professionals have the skills and, importantly, the empathy to provide assistance with people who may be grappling with these issues. All right, before we go into health information resources, I want to just check in with Liz to see if we have any questions in the chat.
Yes, we did.
Okay.
Let's see. I think this was covered, but always worth repeating. What to do, so you had spoken about what to do if you start getting emotional as the librarian getting the question, but what about if the patron begins getting emotional?
Yeah, that's a great question. one of the most important things you can do in that situation is making sure that the patron feels heard and validated and respected. So if they seem to be showing signs of strong emotions, you can empathize with them. You can say, I understand why that would be upsetting. And after you use that approach to show that you respect the patron and that you empathize with them, you can just offer to help them in any way that they can. And in situations like that, being helpful to the person may be more important than any information that you could provide them, potentially. So being able to stay with them and answer questions and treat them as a human being just can make a huge difference, even irrespective of their specific question that they might be coming in with. So that's at least a starting point. Every situation and every patron is different, but those are a couple things I would recommend just as starting points for situations like that. All right, so next. Sorry, was there anything else?
Oh, yes, one other question. And
okay.
Some people started offering their own experience and advice in the chat. We always love to see that.
Yes.
But the question was, when referring, how would you give advice to patrons who have limited or no access to mental health providers, meaning no insurance, can't afford health care, maybe there's limited resources in that area?
Yeah, that's a great question, and it's one that doesn't always have an easy answer, unfortunately. Increasingly, during the last year of COVID-19, there has been an increase in the use of telehealth for mental health services. So if that's a possibility, there may be something that could be arranged in that regard. Another possible option would be to contact social services or a social worker in the area who might be familiar with some potential options that would exist in the community. As you would know, a lot of it will just depend on the local context and what sorts of alternatives might exist in a given community. But those are at least a couple things that come to my mind right off the bat. See, I'm seeing Liz says, with telehealth, we have the compounded problem of limited access to the internet. Yeah, that's a very important issue as well. And in fact, there are, I know that I think the Institute of Mental Health, the National Institute of Mental Health, which is part of the NIH, I believe they also have an informational telephone line that people can call as well. So that can be a great alternative for connecting people with information in cases where they might not have ready access to the internet. So that might be one possibility to at least get started. Okay, and I'm seeing one other question in the chat here. For public libraries, what kind of cooperation or collaboration do you have with shelters or social workers and social services? Well, I know that the public library here in Baltimore does have weekly meetings with a social worker, and they've been able to transition that to a virtual program during COVID-19. But yeah, they have weekly drop-in sessions where people can speak with a social worker. Most weeks there's a designated topic to be discussed, and the social worker is able to connect people with appropriate forms of assistance or resources that may be available. So that's one example that I'm a really big fan of personally, and that I've seen at least in my community. All right, so next we will take a look at some health information resources that can be particularly good for mental health questions. All right, so when you're looking at information online, a lot of us will go to Google first. It's okay, we can admit it. And Google does a pretty good job, but it often gets you a lot of results. and it's not always easy to figure out which ones are particularly good. So what I'm showing here is a site called Medlineplus, and if you're familiar with Nnlm webinars, you have probably heard about Medlineplus before. So Medlineplus is a great resource because it's curated by librarians at the National Library of Medicine who are knowledgeable about health resources and health information and are able to evaluate things for reliability and currency as well. So it's a wonderful resource for a lot of reasons. It's written in easy to understand language. It links out to other trusted resources from the National Institutes of Health, from the Nnlm Foundation, the Mayo Clinic, and other sources. And importantly, it does not have advertisements or endorsements. It doesn't try to sell you anything or push you toward one treatment over another. So Medlineplus is a great website to share with your patrons to learn new information about health in general. If you make computers available to members of the public, Medlineplus is a great option to include in a toolbar in your web browser so that people can find reliable health information just on their own, through their own searching. All right, another resource I'll suggest is Get Smart About Drugs, which is from the Drug Enforcement Administration. This is a resource for parents, educators, and caregivers. Substance use disorders are one facet of mental and behavioral health, and this resource can connect you with information related to substances that may be implicated in a substance use disorder. This is not a resource from the National Library of Medicine, but it's still very useful for finding information about drugs that might lead to addiction or dependency. Another great resource to know about is Nami, or the National Alliance on Mental Illness. This is the largest grassroots mental health organization that's dedicated to building better lives for Americans affected by mental illness. There may be a state or local chapter of Nami near you that works specifically with individuals and families in your community. And if there is a local chapter, they could be a good choice for a partner on programming or even staff training at your institution. Besides having printer-friendly fact sheets and educational materials, Nami also has a guide on navigating a mental health crisis. Okay, next, the Substance Abuse and Mental Health Services Administration. This is an office of the U.S. Department of Health and Human Services, and this is a great site for information on disaster and trauma, substance abuse, youth violence prevention, children and families, and recovery support. SAMHSA is also a great resource if you want to learn about mental health needs in your own community. They have a few annual surveys that they conduct, including the National Survey on Drug Use and Health, which is a great resource that's sometimes cited in official government reports. They also have some collections of state-level data under this data tab in their toolbar here. So they can be a good way to learn about more local data in your neck of the woods. All right. So SAMHSA also prepares some publications that might be valuable in your library, and I've highlighted a few here. In particular, there are some disaster-related resources here, because in the aftermath of a disaster, there can be potentially long-ranging mental health consequences for affected communities. I would add this is true in pandemics as well. So if you're thinking about mental health information for your community in the coming months or even years, information on mental health and disasters might be useful to you. All right, so now we'll just talk quickly about some search tips. It can be good to start out with a more general website like Medlineplus, just to get an overview of the topic that you're interested in before diving into more specialized resources. Keep in mind that there may be more than one term that can be used for the same condition, and that's especially true in mental health. There are a lot of terms that have fallen out of favor for different reasons. So for example, bipolar disorder is sometimes still referred to as manic depression, even though that's not the clinical term that's used anymore. Be aware that a condition can present itself in very different ways for different people. So it can be challenging to say you're having these symptoms and they are associated with this condition. So it's good to be extra cautious about things like that, and we shouldn't be diagnosing our patrons anyway. And finally, though inaccurate, many resources use terms like disease, disorder, syndrome, or spectrum interchangeably. So if you're not getting search results with one of these, then you might try using a different one, and you can potentially get additional results from there. All right, next I'll talk about just a little suggestion that might be helpful. It can be very hard to break the habit of Googling, and that's perfectly understandable. But you can also use Google to find more reliable resources with a pretty simple modification. So instead of just searching for the health condition you're interested in, you can search for the health condition plus the source that you want information from. So if I want good quality information from the National Institutes of Health, I could search for, say, depression, NIH. And that will give me a list of search results, and at the top will be resources about depression from the National Institutes of Health. So I'm humble enough to admit that it's unlikely that everybody will turn to Medlineplus and use that as their go-to for health information in the near future. But this is another simple way that we could encourage our community members or patrons to use Google to find perhaps a little bit higher quality health information. All right, next we will talk about some resources for youth. There are specific health conditions that are perhaps especially prevalent among younger people, and there are some great resources that are tailored for them as well. So we'll take a quick look at some of these next. All right, so this is an infographic from Nami, the National Alliance on Mental Illness. And Nami has a lot of good infographics like this that are available for download. And here is one on some common warning signs of mental health issues in a young person. I won't review all of them now, but there are many infographics like this. They are great for posting at schools, libraries, and many other places as well. So this is one good resource to be aware of. All right, next I want to talk about a couple of suicide prevention resources. Suicide is the second most common cause of death among teenagers and young adults, according to the CDC. Now, there is no single cause of suicide. It most often occurs when the stressors someone experiences exceed their current ability to cope. And that can be related to mental health conditions, as it often is. Making information available about talk and text hotlines is a great concrete step that you can take to introduce suicide prevention resources for younger people. Text lines in particular, like this one from the National Suicide Prevention Lifeline, can be valuable because a lot of younger people prefer texting over traditional spoken phone calls. So this is one great resource to be aware of and to even post or publicize at your library. Another crisis resource I'll mention in this connection is the Qpr Project, which focuses on LGBTQ young people. We know from research that LGBTQ people, both children and adults, suffer higher rates of mental illness and suicidal thoughts and actions, often related to social stigma and to rejection by family and friends. The staff who work the crisis services at the Qpr Project are trained in responding to crises that are brought on by those types of factors. So this is another great resource to be aware of if you're thinking about resources for youth suicide prevention. Now, the American Foundation for Suicide Prevention is another good source of infographics and other materials that you can use in raising awareness about suicide prevention resources. And this infographic is an example of one that you can download from their website. And it lists a lot of the common warning signs that somebody might be having suicidal thoughts. I won't discuss all of them now, but there is one I will highlight just because it might seem counterintuitive, and that is a sudden improvement in mood or a sudden sense of relief. That might sound odd to think of as a warning sign, but research has found that in some cases, people can exhibit an improved mood after deciding to go through with a suicide plan. So it is still a potentially serious situation if someone has some of these other warning signs and then seems to have a sudden improvement. All right, next, bullying. Bullying is a major stressor in the lives of a lot of young people, and it can contribute to mental health conditions. StopBullying.gov is a government resource that has a section for certain groups of students who are often targeted by bullies, including based on religion, health conditions, or because of sexual identity or gender identity. There's also information about cyberbullying and an online prevention course. And Medlineplus also has some good information on bullying as well. Okay, as we wrap up, I just want to look at a few ideas for programming and resources and some possible next steps you can take if you want to learn more about mental health and wellness. One great resource to educate your communities about mental health is graphic medicine. This is essentially just using comics as a way to talk about health issues. And I think graphic medicine is a great option for mental health in particular because the story-based format illustrates the many different ways that mental health issues can manifest themselves in everyday life, including in unexpected ways. So it's great for education and for helping to break down stigma. Next, there are also national health observances, and Nnlm often pulls together resources that are connected with these observances. In particular, May is Mental Health Month. So that's coming right up if you want to think about programming related to mental health for the month of May. And we have this as well. This is a handout mostly oriented for public libraries that's available on the course page for this website. It summarizes a lot of what we've talked about today. It includes examples of open-ended questions, places to find trusted health information, and some search tips for learning about mental health as well. So again, that's on our course page. And it's also great to think about who your potential partners or community resources might be if you're thinking about programming related to mental health. There are many different options for this. They can include programming like support groups or social groups. They can include potentially counselors or psychiatrists, as well as perhaps less expected partners, including career counselors, faith-based organizations, local public health departments, and even hospitals can be great potential partners with your library or institution for mental health programming. So an important thing to remember is to be prepared for questions about mental health. Work with the administrators at your institution so that you all have a plan to make sure that everybody, including volunteers, knows what to do if you need to address a situation where someone might be exhibiting signs of mental illness or might require support or assistance in learning about mental illness. All right, so next we will talk about just a few options for additional training that you can pursue related to this preparation piece. The first is mental health first aid. If you're looking for professional development opportunities, you can think about mental health first aid, which is a 6.5-hour training and certificate. And this is organized by the National Council for Behavioral Health. Now, this is not an NLM resource. We do not officially endorse this, but it's an option that you can explore. Another possible resource is Qpr Training, which stands for Question, Persuade, and Refer. This is a 3-step method that anybody can learn for preventing suicide. I have heard of this being offered to library staff as well as to members of the public in libraries. So it can be both programming or professional development for your own staff. And this training is about 1 to 2 hours long. Now, homelessness can be a result of mental health conditions as well as an aggravating factor for symptoms of mental health conditions that someone already has. So being aware of mental health issues in your library can be very important. One resource for that is the Librarian's Guide to Homelessness by Ryan Dowd, which talks about different ways you can meet the mental health needs of perhaps homeless members of your community. So just to quickly summarize, staying mentally healthy is not always easy, especially during tough times. There can be a lot of stigma and negative attitudes around mental health, and it's important to protect your own mental health and to cultivate knowledge both for yourself and your community about mental health resources. There may not be easy answers to some of the questions that you're asked, but you can do your very best when assisting those with mental health issues, and always make sure to affirm their humanity and their value as people. So it's an important topic to continually discuss with your organization to make sure that you are doing everything you can in this regard. So that's what I have for you. Thank you so much for taking the time to be here. As I mentioned at the top of the hour, this session is eligible for 1 hour of continuing education credit from the MLA, and it is also applicable to the Consumer Health Information Specialization. So my colleague Liz has just dropped the link in the chat to our evaluation. I'd encourage you to fill that out, and that evaluation also includes information on claiming that CE credit from MLA. So again, thank you so much, and I am happy to answer any final questions that people have.
There was one that came in the chat, Jared, and once again, some of our great attendees kind of jumped in and started offering their own experiences, perspectives, but that was, is graphic medicine created for all ages or children?
Yeah, that's a great question. There are graphic medicine selections that are specifically written for younger readers. So I can't think of any specifically meant for the mental health for younger audiences off the top of my head, but I know that there are titles about topics like grieving, the loss of like pets or family members. There are I think there are titles for dealing with bullying as well. So yeah, it's a very diverse field. It's a great source of health information, and I'm confident that you can find information specific to younger readers as well as adults.
I would also just like to add to that, Jared, because I've done a little bit of graphic medicine. That's also graphic medicine is also a great programming opportunity if you would like to get folks to start creating their own short, you know, experiences and panels of cartoons or graphics. It can be for all ages, but you know, if you have children, and just have them start creating a panel, one, you know, drawing about their experiences, that's a great way to start a conversation as well.
Yeah, thank you for that. Yeah, so just as a reminder, the session is being recorded, and within a couple of weeks I will email everyone who has registered for this course to send them a link to the recording, as well as the evaluation link that will allow you to give feedback on this presentation and claim your CE credit from the Medical Library Association. I'm happy to stick around a little longer if there are additional questions, but otherwise, thank you so much for your time and your attention.